Good afternoon, everybody. This is Elizabeth Tiola, the Chief Program Officer at the Early Learning Coalition of Marion County. Before we get started, can we do a really quick sound check? If you can hear us, can you type in the comment button that you can hear us?
Thank you very much, VidMary.
Thank you. Before we get started, I want to introduce the staff that are in the room, so I'm going to let them introduce themselves real quick.
Hi, this is Roseanne. I'm sorry, guys. I'm going to try to sneak in a quick bite of lunch here while you all are talking. This is Roseanne Frick, CEO, and thank you so much again for joining us. We appreciate everything that you all are doing, and know that together we're going to make it through this, and the kids and our families are so appreciative of all the services and stuff. So thanks for being on the call today.
This is Scott Stevenson, Quality Initiatives Director.
Marcel Easter, Business Information Director.
Beatrice Montalvo, HR Director. Dina Johnson, CFO.
And we have lots of special guests on the call today. And before we get started and I introduce our guest, we just want to say from the bottom of our heart, a thank you. And this is, Provider Appreciation. There's a month dedicated to you all. Your specific day is on Friday, and we do appreciate you so much. And we've heard a lot of different people being thanked throughout this COVID process, including our health workers, our first responders, all the delivery drivers, the retail workers that are working at the grocery stores. But we haven't seen enough people thanking our child care providers. So we want to say thank you very much for everything that you've done, for sticking with us through all this, for your patience, for your understanding, for the special things that you've done to make sure that the kiddos that are in your care haven't experienced the COVID pandemic. They think this is life as normal, unless, of course, you ask my kindergartner who thinks he's retired from kindergarten. His words, not mine. But what you do is so vital and is so important, and we are here to love you through it every step of the way. And we have a very special partner on the phone with us today. I want to say thank you so much for you joining us. It was a last-minute request, and you guys have been very flexible at DCF. And Richard Forrester, thank you for all that you've done. Avita, Barbara Brinkley, and our special guest speakers today, Way Reynolds. She helped connect me with her staff who are on the phone with us today. Dinah Davis, are you there?
Hold on. I'm looking for names.
We're looking to unmute you all right now. So we have Dinah Davis, hopefully Cindy Campbell, and Mary Beth Wins. And I hope I said your last name right, Mary Beth. But in just a second, we appreciate you taking the time to join us today. And we do have your PowerPoint that we're going to put up on the screen for everybody.
Okay, Cynthia, you are unmuted.
Great. Good morning, or afternoon. Sorry, it's afternoon already.
Yes, it is. Thank you for being here with us.
Dinah Davis, you are unmuted as well.
Hi there. Good afternoon.
Hi,
We're
Dinah.
actually
Thank you for
in the same room. So you might just want to unmute one of us at a time.
Oh, you're in the same room?
Yes.
Awesome.
Thank you for being with us, Mary Beth. And you guys have the floor. We have our callers on mute, so we can ask for questions whenever you're ready to do so.
Okay, Cynthia, you are the one that is unmuted.
Perfect. Do I need to show my screen, or are you showing the PowerPoint?
We have the PowerPoint up right now.
Is that it?
Yep, that's it. Okay, well, hello everyone. My name is Cindy Campbell, and I'm the policy specialist here with the Office of Child Care Regulation. And we're going to talk to you guys today about the general operations for child care programs, licensing requirements, the department emergency order, inspections that the licensing counselors are going to do, the CDC guidance, and the executive order. You want to go ahead and turn the slide, please? Yep, you can go again. Okay, so I'm going to start with our licensing requirements. These are sections in the Child Care Facility Handbook that I'm going to be specifically talking about. However, the Family Daycare Home Handbook and the School Age Only Handbooks both also have this information in it. It's just the section numbers are different. So in section 3.10 for sanitation, this is where you'll find the guidelines for hand washing and diapering requirements. And we have incorporated by reference the Center for Disease Control guidelines for hand washing. Most of you probably have this little flyer displayed somewhere in your facility, or you've created one that's very similar to it, but you are required by licensing standards to have something posted everywhere you wash hands, everywhere anyone washes hands, that explains how to wash your hands, the process that you're supposed to follow, and the times when you're required to be washing your hands. So, you know, obviously after toileting or diapering, you wash your hands. When you come in from the playground, before you eat, before administering medication, all of those times are listed on there. And obviously during this time with COVID-19, all of us are washing our hands even more frequently. So this talks about the process and when you have to do that and to have this information posted wherever you wash hands. And then the diapering section explains the diapering process and the requirements for washing hands also. In section 3.11 is your indoor equipment, and in letter B, it talks about facilities needing to have a written routine schedule for cleaning, disinfecting, and sanitizing all of the furnishings, equipment, play areas, and materials, and so forth. So all of you should have a plan of when you are supposed to be doing these cleanings. Some things need to be cleaned every day or several times a day. Some things you would normally only clean maybe once a week, like napped linens. So you need to have a schedule of when things are supposed to be cleaned, to be cleaning them properly. And during this time also, you may be cleaning things a whole lot more frequently. And then in section 6.1, communicable disease section. And in this section, it talks about looking for different signs and symptoms of someone who may be ill. And it gives you a lot of examples of what that looks like. And obviously this is probably things that you are currently doing right now too. If you are able to and have the manpower, you're probably checking all the children before they come into your facility and asking questions just to ensure that the children aren't exhibiting any signs of a communicable disease. And then also during the day, you should be monitoring all of your children to see if they start exhibiting any of these signs. Because if they do start acting ill sometime during the day, you're going to need to put them in an isolation area. And that information is located in this section also. Well, the requirements for your isolation area, you know, the appropriate supervision while the children are in that area, while you're waiting for your parents to come and pick them up. And this would include your staff members too. If they start feeling ill, they need to be removed from the classroom. And then in 6.1.2 talks about outbreaks. So if you do find out that you have someone that has a positive case for COVID-19, you need to be notifying the local health department to let them know that you've had a positive case in your facility. And Dinah will talk a lot more in a little bit when we talk about CDC requirements and trying to keep groups separated and things like that. And the reasons for trying to do that and be very mindful of that right now and keeping groups separated is because if you do find someone that's been positive in that, in maybe, you know, your I don't know, 2-year-old classroom, then anybody else that's in that 2-year-old classroom, been working in that 2-year-old classroom, would need to be notified because they'll need to self-quarantine for 10 to 14 days. So anyway, this is the information that is specifically outlined in your handbooks that you guys should be following already. You're just probably doing some of these things a bit more frequently to make sure that you're prepared to handle the virus that's currently in our areas. And now Mary Beth is going to talk to you guys about training.
Good afternoon. I am a senior manager and I oversee the training office here. I'm going to talk to you a little bit about Secretary Chad Popple's emergency order, and that's not to be confused with the executive order. This is the Department of Children and Families emergency order. And what that emergency order states is that to suspend section 402.305, parens 2, parens E of the Florida statutes for the purpose of promoting flexibility and allowing for alternative education and testing methods for childcare personnel where COVID-19 has prevented access to same. Excuse me. The purpose of this EO is to allow a 6-month extension for the completion of competency exams, as these are primarily conducted at our local colleges, which have been closed. Therefore, students that need to take the competency exams will have until September 21st, 2020 to complete their testing. This also means that the training coordinating agencies in high schools will be able to offer the child care courses online while still meeting the requirements of an instructor led through virtual teaching. The Office of Child Care Regulation has opened the time frame window. So when your staff go online to do a course, normally they would only have 45 days to complete that online course. We have opened the window to December 31st, 2020 to allow not only for more time to complete the online course, but to be able to go back to that course when testing is available so that they can refresh and be able to successfully pass the test. Excuse me. Other items that have been brought up during our webinars that we've been conducting, other questions regards to training, I'm going to address right now. First aid and CPR can be completed online. However, you still need to have a trainer attest to your understanding. There are a couple trainers in the state of Florida that can do that virtually. We are recommending that this option only be used for renewals of first aid and CPR and not for people initially trying to get that training. Staff and director credential renewals are still business as usual. There are no delays with processing these. Our credentialing unit is here at our headquarters office working daily, so there are no exceptions on that requirement. Right now, in our past webinars, we have discussed that exams will not be offered online due to the time that it's taken for us to get back to a normal. Knows when we actually will get back to normal. We had a conference call this morning with the training coordinating agencies to discuss that option for the future. So that is something we are looking into. In-service requirements are still required. There's no extension on this requirement. And other than what was mentioned in the emergency order, there are no extensions in regards to training. So are we going to ask questions now or should we wait till the end?
We do have a couple of questions that have come in, so I'll go ahead and read them to you. The first one is, we are planning for summer and we have a few health questions. If staff take a week off and travel, do we need them to take a 2-week quarantine at home upon returning? Also, over the summer, if kids leave on trips, do we take them back or ask them to stay out for 2 more weeks?
It depends if they go out of state.
Yeah, that one kind of depends on where they travel to, and what the, federal guidance is, and if the state guidance has changed at that point about travel. We would just need to pay attention to what's current at that time and take every precaution necessary. If you look at the CDC guidance, it does touch a little bit on, staff that have traveled and things like that, and self-quarantining before they come back to the program. So we would just recommend that you take a look at that, and whatever is feasible that complements what the state is doing at this point would be our recommendation.
Thank you.
Okay. If a teacher has never had their CPR cert, how do we get them training during this time? Can they take it online?
They can take the courses online, but they are required to have somebody, attest to their understanding of it. So they would either have to find someone that could do that, or since it's an initial, we recommend them waiting. I mean, the first aid requirement is not that everybody has to have it in their facility, but I know some facilities require it. But We have the name of a couple of instructors that do virtually attest to the learning and understanding of first aid and CPR that we'd be happy to share. I think we shared it with Richard, so he could go ahead and send that to you.
Yes, and I think we do have that, so I can include that in our frequently asked questions when we update them and send them out tomorrow.
Okay. The next question is going to be for staff that are furloughed. How should we handle the 10-hour in-service requirement?
The in-service requirement is still required, so even if they're furloughed, they should still be doing in-service hours. The department's online classes are available for in-service credit, as well as Office of Early Learning offers free courses that can be used for in-service credit.
Yep, and remember everybody, ELC has a reimbursement program where we can reimburse you for your registration fees for up to $300 per teacher. And then there is another mini grant opportunity stipend that we will talk about again later in our meeting.
That's awesome.
What dates are off limits for travel?
We don't have that information. That would be something that we'd be looking to the CDC for guidance on. We don't specifically know that there is any states or locations that are off limits or something like that. You would just need to make that determination, I guess, for yourselves, for your business, choosing on, where they've gone.
Okay. When is the 9 children per classroom rule over?
We're going to get into the CDC information in just a little bit, and I'm sure Diane will be able to provide some more guidance. Do you want me to continue on with the PowerPoint? I'm going to talk about inspections.
Okay, I have 3 more questions. I'll read them real quick. One of our teachers had one exam left to complete her training, but it was canceled due to COVID-19. I understand the extension allows her to keep working, but original regulations say she cannot be in a classroom by herself. Is there a provision for this?
Yeah, there is a provision for that. That teacher has until September 21st to complete the exam.
Thank you.
So the next question says if they are furloughed, we've been told they are not legally allowed to do anything relating to their usual work.
I think we'd like to talk to whoever wrote that question. We'll reach out to you individually and get more information, and we'll get you an answer to that. So we're going to keep moving forward with our agenda, or with the PowerPoint.
Okay.
Thank you. We'll keep moving. We'll let you know if there's more questions, or when you're ready for more questions, just let us know.
Sounds great. Thank you, guys. So I'm going to talk about inspections. This is Cindy Campbell, and right now our licensing counselors are doing their best to not have to go into facilities, kind of continuing that social distancing as much as possible. So at this time, for routine inspections, if your licensed facility or home is due for a routine inspection during this time, your licensing counselor will be calling you. We'll be doing telephonic inspections for routine inspections to just check in with you, make sure that everything's okay, that you have what you need. If you have any concerns or questions, they're answering those types of things. And then they're documenting it on the inspection report. So that one is done telephonically. However, with routine inspections, in order to renew your license, we have to verify that all health and safety requirements are being met before we reissue a license. So a renewal inspection will have to be done on site. So if you are due for a renewal inspection during this time, your licensing counselor will be coming out. They may call in advance and just request some documentation, things that you can give to them, whether it's personnel files, child files, I don't know, just other document type things that they could be reviewing from the office and not having to spend that time in your facility reviewing that information. But they will come out, they will have all the appropriate equipment, they'll have the masks, the gloves, all that kind of stuff. They will be sanitizing all of their equipment when they leave each facility and before they enter the next one. So they'll be taking every precaution to make sure that that they're safe, that all the people that they encounter when they're in these centers are safe, that they aren't carrying anything to the best of their ability, of course. So that's what's happening with your routine and your renewal inspections. If you are currently not operating, if you've gone non-operational at this time and you are due for a renewal inspection, then your licensing counselor will make note of it, that you are not operating, and that's what we put in our public side of CARES, our licensing system. So it doesn't show that this provider's out to the public. So in case someone is looking for childcare right now, you might see that if you're non-operational, your program is not showing out to the public on that site. It's because you're not operating at this time. Once you decide to open up again, you need to let your licensing counselor know, and they change your status back, and you'll show in the system. Now, if you've turned in all of your paperwork, because if you're doing a renewal, you have to submit all of your licensure application paperwork on time. So it has to be there 45 days prior to your expiration date. And they will make note that you are going provisional. They'll put you on a provisional license when you renew, because they haven't been able to come out and do your renewal inspection because you're not operating. Now, I want to make sure that you understand that a provisional license is not disciplinary. This is not a negative thing. It just means that something was outside of the control of the operator or the owner, and so we couldn't go ahead and issue a regular annual license. We had to put it on provisional while we're waiting for these other items to be able to show in compliance. An example of what that might be is fire marshals are currently not doing inspections. So if you were needing a fire inspection prior to the renewal of your license, then that would be something that would hold you up from getting a regular annual license, because until they've been able to conduct that inspection and then show that you've met your fire requirements, they would not be able to issue a license. There are some other things that possibly could be going on right now that would be documented in your inspection reports too, where if they came out and do a renewal inspection, you're open and they're out there, but maybe some of your children, their immunization records or their student health exams are expired, and some doctors are not seeing well patients at this time, so it's not possible for them to go in and get this renewed. That is something that your licensing counselor would document in the inspection, that certain children's files were out of date, but you would not be cited for it. It's just something that when they came back on their next inspection, they would be looking to make sure that those children's records were updated once things have kind of resumed back to normal, and parents take their children in to get those immunizations or health exams done. So there's certain things like that that are happening that we're aware of, and we're just documenting the information so that we can follow up later and make sure that it was brought back into compliance, but we're not holding the providers accountable at this time for these things that are outside of their control. And my last point that I want to make about this is just please make sure that if you have decided to go non-operational, that you have notified your licensing counselor so that they know to change your status in the system to non-operational. And when you decide to become operational again, you need to let your licensing counselor know that, so they know that you're operating again. A lot of times we get questions, well, can we not open up again until our licensing counselors come out and inspected us? And no, we're not requiring that. If you've chosen to shut down for a while due to the virus and you now want to open again, you just need to notify your licensing counselor so they're aware you're operating, and you can keep on going as business as usual. So I'm going to hand this over to Dinah, because I think our next slide starts talking about the CDC, the EO, sorry, the executive order.
All right, thank you, Cindy. Hi there, this is Dinah Davis, and I'm a manager also in the policy unit, and so we handle a lot of policy development and rule. And my slide begins with an executive order that actually expired, but we continue to talk about it because it is the department's recommendation that you continue to meet the provisions of the past EO as much as possible. We are trying to keep everyone safe, and I know that, smaller classrooms and less people in the room is going to help that. If you're able to, and to the extent possible, we ask that you continue to to operate in this manner. But it's not a licensing requirement. Everything that we're going to talk about now, from this slide forward, are all recommendations. Everything that Cindy and Mary Beth have spoken to you about are all of our licensing requirements. And so we're going to give you this information, its recommendations, and whatever you can fit into your model and into your program is what we will encourage you to do to keep children as safe as possible as we move forward. And I'm sure as the governor opens up the state again, and there are several different phases with that, that there will be less and less provisions that we will be looking at. But at the moment, we are encouraging you to continue with the groups of 10, and as previously listed, it was inclusive of the caregiver and the children. So my examples of this is if you have an infant room and the ratio is 1 to 4, you could potentially have 2 staff members and 8 children in an infant room. For 1-year-olds, the ratio is 1 to 6. So in order to keep that room under 10, you still would have this room will look very similar to the infant room. So it would be 2 staff and 8 children. Once you get above 2 years of age, pretty much you'll have classrooms that look like 1 staff and 9 children. Even if it's a mixed age group and everybody's over 2 years old, that's pretty much what it will look like. And as Cindy mentioned, our staff are going to continue to be on site doing renewal inspections. And so wherever they can see some ways that you can adjust your rooms or think about it in a different way. I know we've gotten questions about portioning big size rooms that may have been, measured for 20 children, like cutting that in half so that you can have 2 separate rooms. And that is all good planning. And if our counselors can make that suggestion, they will be doing so. As far as partition walls, the question has come up several times about, what material can be used to do that. And we keep referencing back to our definition of a stable wall or barrier. That is in the front of our facility handbook. And so any type of material that meets that definition, we would consider that acceptable. And if you wanted to partition a room and make it 2 rooms, our staff just need to come out and do some measurements and kind of adjust what your floor plan looks like if you do that. So it's important that you keep us in the loop. We are here to help, as well as make sure that your license doesn't lapse during this time, and that the children are as safe as they can be, as well as you and your staff. Back to the group size, you have a smaller group in its own space, and we don't encourage you to intermingle groups. This is super important if there happens to be a positive case at the program. If a child tests positive, or one of your staff members tests positive, or somebody has been exposed to someone who's positive outside the facility, it's easier to isolate one group as opposed to having to shut down the whole facility. So usually what that would look like, and this is all guidance that we've gathered from Florida Health Department as well as CDC on this quarantine. If a child in group 1, let's say, comes down with a positive test for COVID, that whole room would be self-quarantined for 10 or 14 days, and you do a deep clean of that room. If there is some intermingling between groups 1 and 2, and for some reason, if there is a positive read out of any of those classes, those 2 classes would be affected. So I'm just trying to illustrate that, when you do have groups that intermingle, it just is going to impact more individuals and more families if there is a positive read at the school. So anyhow, we just want to encourage you to do that. Do it to the best of your ability. Like I said, these are not licensing requirements. We want you to continue on with your day as far as teachers having to have breaks. If you can just have the same person break that room, That way the children aren't exposed to one person who's floating all through rooms. You may need to have multiple floaters that can, step into the room, or always have the same person substitute or cover for a person's lunch break, and not have that, cross mingling. So one other thing I'll touch on is cleaning spaces. If you have multi-purpose rooms that may be used for dining or big art activities or any type of activity that you're moving the children in and out of that room, we ask that you clean and sanitize, all those frequently touched spaces in between groups. That's super, super important. All right, so the slide has moved forward. Our CDC guidance, my favorite website right now. We are on it pretty much every day. They haven't made any updates since about April 21st, I want to say, but it's good information. It's particularly for operators of childcare programs that are operating right now or getting geared up to reopen. It's got lots of social distancing strategies. The question comes up a lot about, social distancing for young children. It's almost impossible. And we understand that. So where you can instruct the children to stay in their space, we'd like you to do that for your school-age children and perhaps your preschool children. But for infants, toddlers, they don't do that so well. And so, the smaller group is going to help with that. And then, having your, childcare providers, the personnel that are in the room, engage with the children and maybe set up multiple activities. And, if there's 2 people in the room, they can have 2 separate activities going on at the same time, and then switch across the room. And, before the switch, maybe clean the game or whatever the manipulatives that are being used for the activity. Setting up activities where children can, self-direct themselves to is always a great thing. It gives children freedom to choose, the activities they want to do. In those situations, you're encouraged to, instead of putting out 4 place settings at the table, maybe only put 2. That way it's not as many children in close proximity with each other. And just the setup of the room will help encourage some of that social distancing. But we do know, like for infants, your personnel in that room are going to be in close proximity to those children because, they're going to need to be held and loved on and nurtured and fed their bottles and things like that. So, face coverings, if you have masks, that might be the room you choose to require it in for the staff that work in the infant room. Again, it's a suggestion. If you have the availability of masks, it may be something that you incorporate into your operation and may look at those younger classrooms to utilize it in. We've had the question come up about face masks for children. And on the CDC's website, it's listed on there, but you definitely want to pay attention to the precaution for children under 2 years of age. So face masks should not be used on children under 2 because it would pose a suffocation hazard. Some other things here, let me just look at my notes, make sure I covered everything. Okay, naptime spacing. For licensing, we require at least 18 inches. If you can, if there's enough space in your room, especially if the group size is much smaller these days, if you're able to accommodate a bigger space between each child napping, please do it. The CDC is saying that ideally is 6 foot apart, but I don't know how feasible that is. Just be sure that that you're meeting your 18-inch mark, and anything above that is just extra and would help with the spread of the virus. Also, placing the children head to toe is also recommended on the CDC's website. We've had some questions about whether or not you have to take folks' temperature. And again, if you want to utilize a certain screening a list of screening questions, and part of it is to have the temperature read of each child and each staff that comes in. That is absolutely up to you. If you have the availability of a digital forehead thermometer, we would encourage it. If you don't have it, we're not asking you to go out and purchase it. Anything else, Cindy, I'm missing?
Prep and meal service.
Okay, so food prep and meal service. It's right there on the screen, but I'm looking at a different set of notes. For food prep and meal service, we definitely want you to make sure that whoever your food prep person is, that they are clear and feeling good when they come to work. You don't want to have folks there working when they're sick, and definitely not in the food prep area. As far as meal service, I know a lot of programs use the family service style, where their children get to, serve themselves at the table. It's part of, their whole learning process about etiquette and sitting at the table and having conversations about their day and about the food they're eating and all of that. The part about the children serving themselves, it's not recommended at this time, since they would be touching the same surfaces and then, potentially putting their hands in their mouth. So that right now, it's not a requirement to serve that way, and we're not encouraging it at this point. All righty. You can forward the slide, please.
Forward the slide.
Do you want to take, we've got about 3 questions. Would you like to answer those or go to the next slide?
We'll take the questions. That's fine.
Okay. So the first question is going to be, how do we conduct monthly fire drills if children have to be kept separate? Also, teachers need to go on break and restrooms. Can director cover their breaks?
Yeah. Okay. So fire drills, if you are open, we do expect you to continue with fire drills. So you may have to adjust your meeting up spot, maybe not have everybody meet under the same tree, maybe split the groups, come up with an alternate meeting site. That way you can keep the groups apart as much as possible. But we do anticipate, that you continue with your monthly drills. Now, if you are a program that was closed for a full month, the month of March, the month of April, we're not asking you to have to go back and make those up. You just need to make notation on your log that you were closed for COVID or for the public health emergency for the full month of March or April or both, however that panned out for you.
Go ahead and talk about distracted adults since you mentioned that.
Okay. Distracted adults brochure. That's a new requirement that came about a couple years ago in statute, where in April and September, the provider is responsible for sharing information with parents about distracted drivers. The month of April, a lot of programs were closed. If you were closed, we don't anticipate having you, meet that requirement at this time. You'll just, pick it up in September when you're operating at that time. So no makeups for that either.
But document it well in the children's file.
And Cindy is saying, and document it well in the children's file, that, the program was closed, and that's the reason for, not having that documented or signed by the parent for the month of April.
And then the other, what else did she say?
What was your other question? Oh, about directors
Filling in.
And yes, use the staff that you have available. Like I was saying earlier, try to, be cautious, and, like if the director is the only person who's there to cover, then you have to do that. But if you have multiple people that can cover rooms, and maybe Cindy's going to cover groups 1, 2, and 3, and then Mary Beth's going to cover 4, 5, and 6. That way, if there is an outbreak or any positive case in one of those classes, it doesn't affect the whole group. If I'm the director and I'm the only person and I have to break for all 6 rooms, then if there is a positive case, potentially that's going to affect the entire program. But it can be done. I'm not saying that you can't. And, we understand that you're operating under the, how many staff you have, how many children you have, and all of that. So we just ask that you do the very best you can.
Okay. The last question that we have is, what level of cleaning are we allowed to do in the class with the children present? What is considered regular versus deep cleaning for licensing standards?
So the regular cleaning that can occur when children are there is, you know, after lunch, you're wiping the table down or sweeping the floor of the crumbs, that sort of thing. The deep cleaning comes into play where there's a lot more heavy cleaners that's being used that could potentially, you know, be a hazard to the children. If you're vacuuming or doing mopping, that can be a slip hazard or a trip hazard and things like that. So we caution you to not do those things while the children are present.
Okay.
So we have just one more. It says, if the program was open and a few parents were not at the school for the month of April, do we still need to get those parents to sign the distracted driver brochure in May?
No, in that case, you would just document it in the child's file that the child was not in attendance from this date to this date. And if they didn't attend at all in April, we're not looking for you to go back and gather that information from the parent.
Thank you. We're good to
Okay.
move on for right now. The rest of you that have submitted questions, they're either questions that we've already addressed before, so you can find them in our frequently asked questions, or we will try to circle back and address them. There are things about like health and safety requirements when it comes to the school readiness inspections. Those are still required, and DCF is still required to do those. So we'll come back and we can keep moving forward with the presentation.
Sure. And you mentioned school readiness. Our partner agencies, the Office of Early Learning, you guys, the ELCs that are putting this webinar on today, we are still responsible for doing school readiness inspections. If you're a licensed program, we look at those standards along with your renewal inspection. So we're going to continue to do that. But if it's, you know, our primary concern was programs that are license exempt that we don't have on a regular schedule always, as well as programs that are school readiness and they're closed. And traditionally, the school readiness contract expires at the end of June. And so we've spoken to OEL, and they're going to extend some of the contract dates as needed. Just to give us a chance to get out there, allow the program to, you know, get up and running again, and we can get out there and do an inspection while children are actually being cared for. And you probably know more about this first responders program, and we usually don't talk too much about it. We just refer folks to the OEL's website if they want information or, you know, want to be involved in that first responders program, caring for first responders and healthcare workers, and signing up for that reimbursement. And then as far as childcare, the childcare food program, we had folks from the Department of Health, USDA food program join us, and they went over a list of waivers that are available. I would encourage you to go to their website for more information about that. But they have some leniency that's available. I think it's available to all programs that are already on the food program. Some are specific to school age programs, and so I don't really have much information about it. We're just going to refer you to them, but we just wanted you to know that there are some relaxation of their requirements at this time, particularly if you're not able to get, let's say, for instance, the right milk to serve to, you know, a certain age group. If you can't get whole milk, but you can get 2%, I think they're okay with that, and you just need to document it. Our other example was, you know, if you're having trouble getting produce or fruit or vegetables or something like that, and typically you would have a vegetable and a fruit along with lunch, and if you can only find 2 fruits and you document that, those are the types of requirements that they're kind of relaxing at this point. From the licensing perspective, we would just ask you to make sure that you document on your menus any substitutions on that menu calendar is a licensing requirement. So with that, that's pretty much all we have. And I think the next slide just says any questions. So we can go back to the ones that you said that we didn't cover.
Basically, we just had a couple of the same questions that was asking. So the group size, they're asking, is that required or recommended? I do think you covered that, but I don't know if you want to speak any more to that particular question.
No, at this point, it's our recommendation. It's not a licensing requirement. Oh, Mary Beth is bringing up a good point. Besides the state EO that covers the whole state, we want to encourage you to know what your local ordinances may be in place, because there are some counties that we've become aware of that have more restrictive requirements in a local EO that is not addressed in the statewide EO. So it's important that you're aware of local ordinances that may have more restrictions on your operation as an essential service. Because of the arrest. Right, and the enforcement of these EOs is much harsher than a citation on a licensing inspection. These are arrestable offenses, and so you need to know what is applicable to you in your area.
And for Marion County, our licensing agent is DCF. So you do want to continue to reach out to your representative that assists you regularly or comes out to do your inspection. And I know on this call we have a ton of people from all over the state of Florida, so that is definitely a great recommendation to ensure who is the local licensing agent for your area. It may be different than it is for Marion County. We do not have any further questions right now. We thank you so much, ladies, for joining us today, and we're very appreciative of the time that you've taken to really kind of dive deep into some of these things that there's so much information out there about. There was one question that we had, which is where can we get the link to the CDC guidance? In the email I sent out around noon today to our it's my mailing list. I included a 17-page interim guidance for child care programs that is from the CDC. It's 17 pages, but it is broken down into different topics, from safety actions to what phases are covered under different places. I would highly encourage you, and there are active links within that document, I would highly encourage you to go back to that email and look at that. That was sent out today. We'll include it in our update for tomorrow as well. But at this time, I would just like to say thank you to DCF and ask these ladies if there's anything else they would like to add.
No, thank you for having us. Yeah.
Thank you. We have about 10 minutes left on our call, and we're going to cover just a couple more pieces really quickly. We are going to end our call on time today, and any questions that we don't get answered, please just hang tight and we'll try to cover them in our frequently asked questions document. That will go out either tomorrow or Friday. It depends on how many questions you have. That takes us a little while to put those on the document. But the next thing, I want to move on in our agenda to the mini grant update. And I'm going to give Scott like 3 minutes to give you a little quick update on that.
All right, I'll go as quick as I can, give you the quick version. So around the mini grants, we're OEL's in the process still of kind of fine-tuning some of the forms and guidelines. And as we get this new information, we want to get it to you all as soon as we can. So if you're an approved provider that's already submitted an eligibility form, I encourage you to go get a pen. There's just a few bullets I just want you to take down, because there are some fairly big changes that you want to take note of. The first is this isn't necessarily a change, but if you have not already submitted your eligibility form, please do so. I'm still the point of contact. You can email those to me at sstevenson@elc-marion.org. So one of the biggest changes that we want to tell you about is initially we had thought that for each of these grants, you would be awarded $1,000 to split between them. That is not the case. You will actually be eligible for $1,000 per grant. When I say per grant, that means the infrastructure and operating cost grant, that's $1,000, and the health and safety cleaning supplies grant, that's $1,000. So you can get up to a total of $2,000 between those. As far as we know, the teacher stipend grant, that is still capped out at $750. So that might raise the question for some of you who have applied and been approved. If you only checked one of the boxes and now would like to check 2 boxes to be eligible for 2 grants, what I would like you to do is to just send me an email and I can make the change on your application for you, and I'll just attach that email to your application. So again, if you want to apply for another grant but didn't initially, just send me an email and I can make that change for you. So another big change, and I know this just off the top of my head, I think will affect 4 or 5 providers that unfortunately were deemed ineligible. But initially we had thought that the providers on probation due to a low VPK readiness score would not be eligible, as well as people on a QIP from their class observation score. That is not the case. So regardless of these scores, they're not taking those into consideration, and you would be eligible to at least apply and potentially get approved as long as you meet the other criteria. So again, VPK readiness rates and QIP for class observations are not being considered. So kind of in connection with that, another eligibility requirement was that providers could not have an open or pending DCF violation. That has been changed. So they're not looking at those DCF violations either. Off the top of my head, I don't think that affected maybe 1 provider, but not many of you, if any. Also, if you are a VPK only provider, we just want to remind you, you are eligible to apply. Going back to the cleaning supply grant, the health and safety cleaning supply, we had initially thought that moving forward, any expenses incurred you could be reimbursed for after being approved for your eligibility form. This has actually been moved back. So any purchase, any items you've purchased for cleaning supplies going back to March 1st can be reimbursed for. I think initially it was April 15th.
We had a question, Scott, that said if out of county, if it's statewide, and the answer is yes, it's statewide. The grants are statewide. And then the question was, if out of county providers, can they apply?
Yes, they can. Yes. So that was another change. Initially, we had thought out of county providers could not apply with us, but you can. So, and you can apply to your home county as well.
That takes care of that. So if you hadn't applied for the grants because you were a POP, can you now apply?
Absolutely. Yes, you can. And you don't need to resubmit your application. I've sent you an email that, said, unfortunately, you are not eligible. You'll be receiving another email from me stating you are eligible. So no need to resubmit an application for that. And just to reiterate again, this is open for one of the eligibility requirements is that you have to be open for business or plan to reopen within 2 weeks of applying.
10 days.
Excuse me, 10 days.
10 business days.
10 business days.
Okay, so we're going to wrap that portion up because we literally have 5 minutes left before our staff have to jump on another call. So Marcy wants to talk really quickly about the registration fee reimbursement. Before she does that, the last thing I want to say, parent fee waivers we are still going to carry that through June 30th. That was a question. So the coalition is still going to cover your parent fees through June 30th. So Marcy's going to wrap it up for us with registration fee reimbursement.
Okay, on that parent waiver fee, because I know somebody has also asked the question on here. So let me go back to it. I apologize. Whether the payments for VPK and SR have been extended to cover May. So right now that is a yes. So that kind of falls in line with that parent fee.
Wait. Oh, what was the question?
Be extended to cover through May.
Has what been extended to cover?
The payments for VPK and SR.
For VPK,
Now,
so you're talking about for kids that have attended or not attended, regardless whether you're open or closed.
Okay, so enrollment. Okay.
So, and you will have on that, you will have more guidance coming out later this week on those pieces.
Yes, please hang tight for that, and we'll get you some more clarification on that piece.
Registration fees. We had an update to ESS Mod yesterday that is putting some pieces of the registration fee reimbursement in. So what you will be seeing in your email come out here in the next week and a half is going to be a certification to those providers that have marked that they collect registration fees on their profile. With that, you're going to have some questions that you're going to need to certify as to, have you collected your fees since July or have you not? Please keep a lookout on this. This is going to be how we handle our next steps in processing our registration fees.
And so that being said, we're going to wrap up our call for today. We do have some additional questions that we will try to answer through our frequently asked questions, or I will send one of our team. It might not be me, but it might be either from the quality department or from me or Scott or Marcy or Deanna. We might be able to represent in on this one. If you have a question, you may get an email from one of us with a specific answer to that, because we won't be able to cover all of your questions today. But we do want to thank you again so much for all that you're doing. And we want to thank people that joined our call that have never been on our call before. You're welcome every week, by the way, at 1 o'clock. See you here then. But on Tuesdays, 1 o'clock, this is our date. So we will wish you a great week, and stay safe, stay diligent with your cleaning, wear your gloves, and we'll see you back here next week at 1.